What is cancer? Cancer is a disease where abnormal cells grow uncontrollably or spread to other body parts. My name is Lori Jones. I'm a senior at Western Carolina University. I am going to talk about using tiny drones in medical innovation when it comes to curing cancer. When you hear the word innovation, a lot of times drones are associated with it. By flying medical supplies to hospitals or blocking tumors in the immune system, when it comes to medical innovation, the answer is drones. There are 5 types of cancer. The first type is carcinoma, which begins in the skin or tissues that line or cover organs. An example of these cancers are prostate, breast, lung, and rectal. Breast and lung cancer are one of the leading forms of cancer. Sarcoma is the second kind of cancer. It begins in the bones. Examples of this kind of cancer is cartilage, fat, muscle, or blood vessel. Also, too, bone cancer is considered one of the cancers that hurt the most painful. The third is leukemia. It is a cancer of white blood cells. Lymphoma is the fourth. It begins in the cells in the immune system. Examples of this is Hodgkin's disease. The fifth is brain and spinal cord cancer. It begins in the central nervous system. Your illness never defines on who you are, and as everybody knows, nobody fights alone when it comes to cancer. I'm going to talk about a doctor who is helping develop the tiny drones. It's Dr. Nwega, and this is the institute he works at the Dana-Farber Cancer Institute. Cancer is a huge problem. We need to win this fight together. By 2025, 19.3 million cases of cancer is predicted to be diagnosed. 90% of deaths are caused by the spread of cancer. My name is Lori Jones. 4 years ago, I went for my yearly mammogram. My mammogram came out irregular. It was followed up by an ultrasound and biopsy. I was diagnosed with first-stage breast cancer. Nobody ever thinks it can happen to them. And they never get the life-changing moment and the words that are spoken, you have cancer. You start out with a simple test, and then it ends up being an ultrasound, and then it goes to a biopsy, and then to your husband sending their hole in your hand as you get those words. The thoughts of chemotherapy and losing your hair is absolutely terrifies you. I don't know. When I first was told I had cancer, the only thing I could think of was I'm going to lose my hair. I ended up having a lumpectomy and only had to go undergo radiation. I thought I was very lucky. At 5 years clean, you're considered a cancer survivor. So I'm going into my 4th year, very excited, 1 more year to go. And I was at my 4th year mark this past year, and another tumor was found. Every time you go in for a test after you have cancer, you are terrified that you're going to have those words again. The forever cancer patient came back to me, a reoccurrence. There are 3 kinds of cancer treatments. The first is surgery. It happens when the cancerous mass is removed. Then it is either followed by radiation or chemotherapy, depending on the stage and spread of the cancer. Radiation is the next one. It uses high doses of radiation to kill cancer cells. Before you start radiation therapy, your body is marked in marker where the radiation dial needs to aim. These marks are called tattoos. They're definitely one kind of tattoo you never want to get, and you never forget the day you get your first tattoo. Chemotherapy is the third. It uses drugs to stop cancer growth. If you ever go to a children's hospital, it breaks your heart to see the kids under chemotherapy. Radiation has many side effects, along with chemotherapy and anything else you have. Some of those side effects include fatigue, concentration problems, nausea, vomiting, sunburn pain, headache. I think one of the most common side effects is sunburn, and you just take that for granted, but it hurts so bad. It just, at the end of radiation, you just are in so much pain, so tired, so confused, just trying to live day to day life. Took 4 weeks off of work, did radiation, and I did radiation, and I went to work every morning. So I got up at 6 o'clock in the morning, was at the radiation clinic, and then I went straight to work. And I'm telling you, I was so tired, so miserable. It was just horrible. Chemotherapy side effects I have not had to have yet. I think that is coming for me. But it is hair loss, infection, anemia, vomiting, and fatigue. For the hair loss, they also have a cap now that you can buy. It's very, very expensive. It freezes your hair follicles, and they say that the hair loss isn't as bad. But some insurances pay for it, but that is a new discovery for cancer. Dr. Wilfred Nowega has developed tiny drones. They are targeted to kill cancer cells that have spread through the body. Nowega is working on implants that are drones that carry medicine directly to his patients. Drones are implanted in tumors carrying immunotherapy medicine. It is programmed to work together with radiation to trans white blood cells to train white blood cells to. I'm sorry, that's a tongue twister. To train white blood cells to fight cancer. Cancer cells begin to die. The immunotherapy medicine acts as a homing device. It travels to kill cancer cells that spread. Basically, the doctors train the white blood cells to attack the cancer. After the job is done, the drones become biodegradable and dissolve. So that also stops having to go back in and do surgery. I mean, all these surgeries you have are hard on your body, and they do things to you, even having to go under anesthesia. So it being biodegradable is huge because, believe me, after you've had cancer surgeries, radiation, chemotherapy, you are sick of being cut open. The idea is to insert the drone before radiation to avoid chemotherapy. This way, the body intends to fight the cancer itself. So therefore, we do radiation, which isn't as bad as chemo, and we skip the chemo. This will also preset cancer from coming back, which is you just thing, and you just worry. Just think of all the stress you go under after the therapy. Is it going to come back? Am I going to get that phone call? I mean, it's just so horrible. The drone does highly localized damage to tumor cells, which allows smaller amounts of the radiation dose. Drones with some cancers may have barriers in reaching the target. So that's another thing you have to worry about with this test, with this drone is, will it hit the target? And that's another big test they're having. The doctor feels lung cancer patients could really benefit from the tiny drone. There are two key routes in targeting drones that they are looking at, and that's inhalation and intravenous. Inhalation goes through the mouth and nose. Intravenous, of course, is with a needle. The doctor investigated radiation compared to inhalation. What they found was investigation showed administering the drone would be more effective in damaging the tumor. When looking at intravenous, it was proven the size was optimized to ensure increased circulation and tumor uptake. Longer circulation helps the drone to break the tumor. On picture A, the cartoon showing both intravenous and inhalation delivery of non-particle drones. B shows TEM image of lung targeted with drones. C shows absorption specific of drone technology customized by inhalation to lung tumors, particle drones are good because they can be loaded with drug-like cannabinoids that help prevent side effects like nausea, vomiting, pain, and help appetite. Cannabinoids can help stop cancer growth, and that is proven. Now we're going to look at some pros of the tiny drones. Of course, it's to avoid chemotherapy. What every cancer patient wants to not do is to avoid chemotherapy. Also, too, when you have chemotherapy, you have to go through such a thing as iron infusions because your iron falls, your blood falls. Some people say the chemotherapy will kill you faster than the cancer. And to lessen the risk of cancer return, which is the main thing, you get done with this, it should be done. And to lengthen your lifespan, of course. Now, of course, the cons of this, like I said before, is testing the drone. How do they test that? How do they know that the radiation didn't help stop the cancer, that it was the drone? So Dr. Nawaga is looking into that. And to pinpoint the exact location of where to put the drone, which is another thing they're testing because, of course, if it's not going to do any good if you don't get the right target. Tiny drones are a hope for the future to all cancer patients. It's less invasive, and like I said, the worst thing apart of cancer is having chemotherapy. And sometimes you have to get chemotherapy because of how like your cells are, and also of the risk of coming back. A lot of times you have chemotherapy because it stops the cancer from coming back. So think of like a tiny drone would stop that. Tiny drones are definitely a hope for the future to all cancer patients.